Claire Corish, and I'm Professor of Clinical Nutrition and Dietetics in UCD in the School of Public Health, Physiotherapy and Sports Science, and a member of the Institute of Food and Health. So I'm delighted this evening to welcome you here on this very blustery evening. I'm glad we're all online rather than face-to-face. And this is the final lecture in the Public Health Lecture Series 2003, which is organised by the Institute of Food and Health. So the purpose of these lectures is to provide evidence-based information on topics of interest to public health. And I'm delighted this evening to welcome Associate Professor Breige McNulty, who's going to present to you this evening on nutrition and heart health, what really matters. So Breige, as I said, is Associate Professor in Human Nutrition, and she is based in the UCD School of Agriculture and Food Science and the UCD Institute of Food and Health. She completed her undergraduate degree and PhD in Ulster University on the topic of human nutrition. And for the last 15 years, she has managed the National Food Consumption Surveys in Ireland, collecting detailed data on dietary intake and lifestyle, which spans from 1-year-olds to those aged over 65. Breige's main research interests are in using food consumption data to gain an understanding of the impact of nutrients, food ingredients, and chemicals on health, with a view to underpinning food safety and policy. She has contributed and published over 100 research papers within this area. And Breige will be joined by Orna O'Brien, and Orna is the dietitian for the Irish Heart Foundation. So in this role, Orna coordinates nutrition information for the public, for healthcare professionals, and for patient support groups. And she leads several health promotion programs across at-risk communities. Orna is a CORI registered dietitian who specializes in heart health. And prior to working in the Irish Heart Foundation, she worked for several years in St. James's Hospital across a wide range of areas, including cardiology, cardiothoracic surgery, and cardiac rehabilitation. She has a special interest in behaviour change, in women's health, and in environmentally sustainable diets. She holds a first-class honours degree in human nutrition and dietetics from TU Dublin and Trinity College, a research master's degree from UCD, and is a member of INDI, the professional body for dietitians in Ireland. So I'm delighted now to hand over to Associate Professor Breige McNulty, who can start the presentation. Just before Breige starts, can I remind you to put any questions that you would like answered as the presentation goes on into the Q&A function. And Breige and Orna will do their very best to try and answer all of your questions at the end of Breige's presentation. So thank you and welcome, Breige and Orna.
Thank you, Claire. And I'll get, I suppose, right to it. So for the next 30 or so minutes, what I hope to take you through is to look at really heart health and how nutrition impacts that, and really what we should be focusing on. And in order to do that, what I'm going to do is, I suppose, start the baseline by kind of looking at really, well, why is heart health important to us? Why should we focus in on that? And then I want to follow that on by looking at the risk factors in terms of our heart. And then how does nutrition influence those risk factors? And then at the very end, I kind of want to sum up and say, well, what can we do ourselves in order to keep our heart healthy? So if we start at the beginning, and we probably all know this, but why is a hearty health important to us? Well, it's important because it has one sole purpose. It needs, it's the pump that we have in our bodies, and that pump is required to push blood through our circulatory system. So it provides that oxygenated blood and nutrients to all corners of our body and to all our organs. And without it, we wouldn't be able to survive, literally. So it has a really, really important job, and therefore it's really important that we can help create a really healthy environment for our heart and the overall circulatory system. And in that, I want to mention, I suppose, blood pressure as well. So it's not only important that we have our pump, our heart, and the blood that it pumps around that. It's also that we need that pressure in order to do that. So we need to be able to pump that around, and therefore we need a healthy pressure in order to do that. And we look to get our blood pressure to be around 120 to 80, and that's where we say our systolic and diastolic. So there's two numbers that we look at, and just to note, our systolic is our highest pressure, and that's when our heart has contracted, so it's the greatest pressure, and it's usually around 120, and then diastolic is when our heart relaxes, and it's at the lowest pressure, and we want to see it in around 80. And so they're all important components of a healthy heart. So what happens is when we don't have a healthy heart, well, we can have a disorder, and those disorders are called cardiovascular disease. Now, cardiovascular disease has many disorders included in that term, and you can see a list of them there. And basically, it is a group of disorders that affect the heart and blood vessels. But I suppose for the purpose of this presentation, I'm really going to focus in on your coronary, your cerebral, or your peripheral artery disease, because they're probably the ones that we've heard of when you think about a heart attack, or if you have a stroke, for example. They're the terms that are related to this. So what's the big issue in terms of cardiovascular disease? Why is it so important, and why should we keep our heart healthy? Well, if you look at the figures, and these are the figures taken from 2019 from Our World in Data, and if we look at overall deaths globally in that year, we can see that the highest proportion of deaths on a global basis come from heart disease. So 33%, you can see it there right at the top. So that's compared to all other deaths, and that equates to 18.5 million deaths. And if we look at more recent figures coming from 2021, that actual figure of the deaths per year has increased to 20.5 million deaths. So it's increasing the amount of deaths that we're seeing from heart disease, and it's the biggest killer. So we need to, I suppose, do something about it. We need to be concerned about it. We as individuals should be trying to keep our heart healthy in terms of it. So before we can do that, I think we really need to understand what's happening in terms of cardiovascular disease. And cardiovascular disease, if we get down to the crux of it, is a blockage in arteries. So if we look at the image here, we can see in a normal artery, we have free flowing blood, and that's what we would like to see. But when we have issues and what we call atherosclerosis, this is leading up to a potential event such as a heart attack and a stroke, is where we see this build up of fatty plaque, and it's fatty deposits that build up in between the layers or cell walls of our arteries, and this causes a blockage. And it can grow and cause a complete blockage that completely blocks the blood from flowing, and that causes the issues. It also can get to a stage where it may not completely block it, but the pressure of the blood rips the top of this, what we call plaque, off, this fatty deposit, and then our blood starts to clot around it to stop that leakage, which is a normal practice that our blood would do normally. So if we get in a cut in our hand, we have a clotting factor there that seals it up for us. But in this situation, what it can mean that clot can also mean that we completely block arteries. And this doesn't happen very quickly. It just doesn't happen overnight. It happens over a period of time. So we gradually build up these plaques, and therefore these are what cause the issues. So what are the risks, or what are the risk factors in terms of building up these plaques? Well, as you can see from this diagram, there's many risk factors in terms of cardiovascular disease, and we split them into modifiable and non-modifiable risk factors. And you can see the red here are the non-modifiable risk factors. So as we get older, our risk increases. We can't change that. We can't change, males tend to have a higher risk of cardiovascular disease. And now this equals out after menopause for women. If there's a family history, you tend to have a higher risk factor. And also if you're a certain ethnicity, so African Caribbeans, for example, have a higher risk of cardiovascular disease. These are things that we cannot change. But as you can see from the other side, from the green points, these are all things that we can change. These are what we call modifiable. So what I want to do is go through these modifiable risk factors and kind of explain, well, why or how are they affecting cardiovascular disease? And I'm going to start with cholesterol, because this is the one that we probably all hear about in terms of cardiovascular disease. So you might go to your GP and you might get your cholesterol checked. And so they're looking at the levels of cholesterol. Now, you may think, well, why do we need cholesterol? Why is it there? Well, it's essential for us. It's not that it does nothing. We do need a small amount of it. It's produced in the liver and it's produced from dietary fat. And it's really important in the component of our cells within our body, and also helps us to produce hormones such as the steroid hormones. So it's really important in that role. And it circulates throughout the body in terms of the blood vessels in particle called lipoproteins. Now, the thing with cholesterol is that there's different types of cholesterol. And you can see here that there's two main types, and one that you probably all heard of is the LDL and the HDL, or the good and the bad cholesterol. And the reason they're called good and bad cholesterols is they have different roles. So LDL cholesterol is called the bad cholesterol. And the reason it's bad is because it actually can stick to your arteries. So when we talked about those fatty deposits earlier on that cause their atherosclerosis, or the lead up to an event, a complete blockage, it's actually this LDL cholesterol that infiltrates that the wall or the cell walls of the blood vessels and starts to build up. So the more that we have circulating in our blood vessels, the more risk of these plaques are in terms of developing are. Then the other type of cholesterol that is HDL cholesterol, and it's called the good cholesterol because it actually mops up the cholesterol left behind in terms of our arteries. So it gets rid of it, it carries it to the liver, where then it can be broken down and passed out of the body. And so it takes it away from the circulation. And hence, when we look at those cholesterols, we want more of this good cholesterol within our bodies and less of this LDL cholesterol. So we look at that ratio. In terms of blood pressure, again, hypertension is a risk factor in terms of cardiovascular disease. And that's because if we put greater strain on our blood vessels by putting them under a prolonged pressure, like anything, like if you think of a tire that you blow up and it's under pressure a huge amount of time, it actually makes them weaker. And that weakerness makes them narrower and also puts extra strain on the heart. And that's the issue. And that therefore it increases the risk of a cardiovascular event as well. The other risk factors are obesity. So obesity means that we are carrying extra weight. And that means that the heart has to work a lot harder to pump all that blood. So there's about 5 liters of blood in our body, and it has to pump it around the body the whole time. And if we are carrying extra weight, it actually has to do a bigger job. So it's more pressure on the system. Also, those individuals who are suffering from obesity tend to have raised blood cholesterol levels, blood pressure, and an increased risk of type 2 diabetes. Again, all are related to increasing the overall risk of cardiovascular disease. And also how we carry our weight has an impact. So those that carry weight around the central area of our body, so if you're apple shaped, that you are actually at higher risk compared if you carry the weight maybe around your hips. And that's because that weight around the central area can actually infiltrate the organs and actually disrupt the metabolic balance within those organs and cause issues that increase the risk of cardiovascular disease. Physical inactivity is another risk factor, and the inactivity is the risk factor. So if we were to have regular physical activity, what that does is actually, again, it helps maintain our healthy body weight. It actually increases HDL levels, so that good cholesterol that we talked about in terms of if we can do vigorous activities. It improves our work efficiency of the heart and reduces blood pressure. So like anything, if we don't use the organ, the heart, or the muscle that it is, it actually won't be as efficient. So we have to use it. And overall, if we can be physical activity and abide by the recommendations, we could decrease the risk of cardiovascular disease by 15 to 35%. And another note on top of that is it's not just physical activity. So it's not just to think about, I need to get my, 30 minutes probably in a day. if you have long interrupted sedentary behavior as well, if you sit down all day, it actually has another effect, and it actually can increase your cardiovascular disease, even if you are meeting the current physical activity guidelines. So it's about getting up and being more active can actually have a beneficial effect. The other risk factor is smoking, and we probably all know this, but smoking has a real negative impact and increasing the risk of cardiovascular disease. And the reason that it will do that is it actually increases our blood pressure. It decreases the amount of exercise that we have or we are able to do. It actually can increase the risk of bloods to clot, which we don't want it to do. And then it actually can decrease that good cholesterol, the HDL levels within our blood as well, which we don't want. So there's many knock-on effects from smoking, and therefore it is a real risk factor for cardiovascular disease. So it would be that you would need to give up smoking to reduce that risk. Another risk factor to note as well is suffering from type 2 diabetes. So type 2 diabetes is it's a lifelong condition where there's actually too much in the blood, and our bodies are no longer able to allow that blood to be absorbed in the cells, or we've limited capacity in order to do that. And what happens is that there is blood sugar is then circulating in our system at a higher level. And that blood sugar can actually mean damage the cell walls within the blood vessels, and that can lead to an increased level of fatty acids or fatty deposits that are being deposited in those in the blood vessels, and that's why it can relate to an increased risk of cardiovascular disease. And those people who are suffering from type 2 diabetes are more likely to develop heart disease and stroke than people who do not have diabetes. So there is that link there also. So those are the particular risk factors. And for now, what I want to focus in on is the nutrition aspect. So what are the beneficial effects in terms of nutrition and the other effects from nutrients that we probably need to be a bit more concerned about? And these are the ones that I'm going to focus in the next few slides. And I just want to note also that there is research done that says that suboptimal diet is a major risk for developing CVD. So although there is these other risk factors that we can go through and that we have gone through, a suboptimal diet is also a major risk factor. And studies have shown that 49% of all CVD related deaths in 2016, when they looked at it, were attributed to dietary risk. And this means that there's something that we can do about these, because this is really modifiable. This is what we consume, and this is what we can change. So if we start to go through these, and I suppose the first one that we kind of always think about when we think about maybe cardiovascular disease is fat, because fat relates to obviously cholesterol. Now, when we think about fat, we should think about total fat, and there's many different components of that total fat. So not all fat is the same. Like cholesterol, good and bad, there's not that we want to brand it good and bad, because all fat we need to a certain degree, but we don't need too much of any one kind, really. So these are the components of total fat. So we can see saturated fat or unsaturated fat, which consist of monounsaturated fat, polyunsaturated fat, and you've probably heard of omega-6 or omega-3 polyunsaturated fats as well that come into that. And we've trans fatty acids. And they all affect cholesterol in a different way. So we'll go through that and to show how the fat that we consume in our diet can have a positive or negative effect in terms of cholesterol. So we start with our trans fats and our saturated fats. So we know from the research that if we can reduce the amount of saturated fat in our diets, it actually will have a beneficial effect by reducing overall cholesterol, but also LDL cholesterol, that bad cholesterol that we want to get rid of, that it may be causing the issue, and therefore reduces the risk of a CVD event. Also, in terms of trans fatty acids, so trans fatty acids are fats that we would find in fried foods, commercially baked goods. They're hydrogenated vegetable oils that are used in these products. And what we know from the research is that increased intakes of these trans fatty acids actually increase our LDL cholesterol, which is our bad cholesterol, and decreases our HDL cholesterol. And therefore, we need to be able to limit these trans fatty acids. So both saturated fat and trans fatty acids, we actually need to limit or reduce the amounts that are coming through from our diets. And just to show you in terms of the research, or some of the research that I've done in terms of looking at population nutrition, you can see here, these are the different types of fat that we've gone through, and we look at it in terms of recommendations by the percentage energy that we get from these fats. And across here, you can see there's different abbreviations, but there are different survey names, and really they're looking at children, teens, and adults, and you can see that from the different age groups. And this is the recommendation in terms of where we want to see our total fat intakes. And usually we want to see it between 20 to 35%. And if you look at across our different population groups in Ireland, we can see actually we're quite good in terms of that. But what we're not really that great at is if we look at the saturated. So saturated, there is a recommendation from the European Safety Authority that would say as low as possible, but also we would look at it in terms of just having it below 10%. But even at below 10%, we're really not meeting that in any of our population groups. So we have a long way to go in terms of the amount of saturated fats. We're getting too much in our diet and we really need to reduce it. In terms of our trans fats, again, it should be as low as possible, but also you can look at the recommendation in terms of having less than 1% energy from trans fats. And what we can see when we look at this is it is less than 1% in all population groups. We don't have the data for the teens as yet, but what is really nice to see that it is less than 1%. And I think that's a great achievement that we have met that in terms of our population. So really need to focus on the saturated and trying to reduce that. So if we reduce it, where do we go? Well, what we can do is remove or reduce saturated and replace it with our PUFAs or MUFAs. So that's our unsaturated fatty acids. And we know from the research that that will reduce total cholesterol and LDL cholesterol. So it'll have a positive effect. So that's one thing that we can do. The other thing, though, in terms of watching out what we replace it with. So some people would say, well, what about replacing the fat with maybe carbohydrates? So getting more energy from our carbohydrates. But it's to note that not all carbohydrates are the same. And if we replace saturated fats maybe with refined carbohydrates, this can actually have a negative effect. It can actually decrease HDL cholesterol and reduce LDL cholesterol particle size. And that reducing the particle size means it's actually harder for our bodies to remove it. So we really don't want to do that. But what we can do is maybe look at other carbohydrates, because not all carbohydrates have the same nutritional value. And what we know is fiber and whole grain carbohydrates, so those rich in those fibers and whole grains, are actually really important and have a positive effect. So we know that strong evidence in relation to things that intakes of whole grains and cereal fibers actually decrease the incidence of cardiovascular disease. And trials, so randomized controlled trials, indicate that a higher intake of certain types of these fibers and whole grains can lower total cholesterol and LDL cholesterol, and also have an effect on lowering blood pressure as well. So these are really important to get more of in the diet. And one of those particular fibers is oat beta-glucans, which you may have heard of. They're a type of fiber that we find in oats, a soluble fiber. And the studies have shown that this oat beta-glucan has or can lower blood cholesterol and therefore reduce that risk of heart disease. So these are really important fibers. So it's a really good source of that in terms of oats. But again, to take us back in terms of where we're at a population level, and again, we're looking at the different groups here in terms of children and teens and adults. And this is taken up from some of our research that we've done here in UCD with Cork as well. When we look at overall carbohydrates, the recommendation would state between 45% to 60% of our energy should be coming from our carbohydrates. So we're pretty much okay in terms of our carbohydrates. But when we look at our fiber intake, we can see that it's not that good, because our fiber should be, for adults anyway, it's slightly different for other population groups, but it should be up to about 25 grams a day that we should be getting from fiber, and we're nowhere near that. So we really need to look at the types of carbohydrates and increase those whole grain and fiber content. And another way of getting that fiber is taking consideration of fruit and vegetables. Now, fruit and vegetables give us lots of good things, but if we look at intakes again across our population groups, you would like to see this between 400 to 500 grams a day, but at least 400 grams a day, that would relate to your 5 portions. And again, we're nowhere near that. So we don't have great intakes of fruit and veg. So all of these are positive impacts we could do in terms of our health, our heart health. Another component that it's important to look at is salt. So we've always probably heard that we need to reduce our salt. And the reason we need to probably think about salt is linked to high blood pressure. And therefore, that's why it would increase the risk of heart disease and stroke if we've too much salt in our diets. So eating salt would raise the amount of sodium in your bloodstream and reduce the ability of your kidneys to remove the water, and therefore that results in the higher blood pressure due to the extra fluid and the extra strain. So that's why salt is related. And if we look at the research that we've carried out, and what we can see here is that we look at adults intake, and it's been estimated that just comparing the dietary intakes, 8.3 grams of salt per day is an average what we're consuming. And that actually doesn't allow for discretionary or additional salt that's added during the cooking or when you're at the table individually. And if we accounted for that, it could be up to around 10 grams per day of salt that's actually being consumed. And that's way above the target that we want to see, which is around 6 grams per day at a population. And again, if we kind of look at the main food sources, it's really coming from our meats, our processed meats particularly, and also our breads. So we need to kind of be careful in terms of our salt intakes and kind of look at where our salt is coming from and trying to reduce that. And then alcohol. So alcohol is important, and there is a very clear link between regular drinking too much alcohol and having high blood pressure. So we know that research is there. And it's really recommended that we stay within the limits that are recommended. And you can see them over here in the purple box, that it would be 11 units for women and 17 units per week for men as well. So also it's to note that heavy or binge drinking has also other negative effects in terms of increasing risk, blood clotting, increasing the endothelium function, which is the cell walls of the blood vessels, and also increasing in central obesity as well, because alcohol, whether we want to acknowledge it or not, it has a huge energy value. So the more that we consume, the more energy we're getting from our diets. And if we don't use that energy, of course, it's going to be stored as well. So really, we should have stick to the maximum, which are only they're not a target. We should try and keep it as low as possible in terms of alcohol intake. And now I'm not going to go through all the micronutrients. There's particular micronutrients that research has said that are related to cardiovascular overall health. And they would be in terms of vitamin D, in terms of folate, and in terms of the antioxidant vitamins A, C, and E. But what I think is important to note here is when we look at these in research, what's really notable is that the observational studies that have shown a benefit usually are with whole foods in terms of the whole food of the diet, whereas the trials that have been done on them are done on supplementation. And what we see is that we don't see the benefits by just taking supplements. And I think this is important because we need to think about the whole food itself and all the components that make up that food, not just the micronutrients that it could be contributing, but also, as we talked about, the whole grain, the fiber content, etc. So it's interesting that we do see relationships with micronutrients, but more so when we think about the foods. And another thing to note as well is the plant sterols and stanols. So you may have seen the products being advertised in supermarkets that are advertised at low in cholesterol. And this is in relation to these sterols and stanols. And what these are they're phytosterols. They're derived from lipids from plants. And they are part of the plant cell membrane. And they're actually a very similar structure when we look at them in terms of the cholesterol. And what happens is, because they're such a similar structure, it actually reduces the amount of cholesterol being absorbed in the gut. So that's how they can reduce the amount of cholesterol in terms of the overall cholesterol within our blood itself. So they have a positive impact. And you see some of these functional foods that are advertised or available on the market in Ireland today that can have a beneficial effect. Now, I've talked a lot about the different components, and we can talk about salt, we can talk about fiber, but we don't eat these nutrients. We eat foods, as we all know. So it's important that we kind of think about that. Well, what is the overall dietary pattern? And is there a dietary pattern? If I want a healthy heart, you know, what patterns could I potentially follow? And there are a couple. And one particularly is the DASH diet. So this DASH stands for Dietary Approaches to Stop Hypertension diet. And it was a diet developed in terms of lowering blood pressure. And obviously that has an important effect in cardiovascular risk. And what it does, it puts an emphasis, this diet, on portion sizes, eating foods low in salt and saturates and high in potassium, calcium, magnesium, fiber, and protein. But really the diet, if you look at it, and you can see the image there, is talking about plenty of fruits, vegetable, whole grain, low fat dairy products, poultry, fish, beans, and nuts, while limiting those foods high in saturated fats, as well as confectionery and sugar sweetened beverages. So very much, if we look at the different components that I focused on over the last few slides, it's kind of bringing all of those together in a one approach in terms of the DASH diet. Now, there are others as well, not to say this is the only one that you potentially could look at. There are the Mediterranean diet, for example, but also plant-based dietary patterns. And I know we're becoming more, I suppose, focused on these in terms of sustainability as well. And the good thing to note about these is the plant-based dietary patterns are or have been associated with a lower risk of cardiovascular disease as well. And of course, they're characterized by a higher consumption of fruit and vegetable, legumes, whole grain cereals, and fish and poultry. What it is important to note, though, that not all, when we think about plant-based diets, we need to be careful about the types of foods that we get in terms of this, that they should be whole foods and not maybe highly processed foods, because it's important to look at, for example, the salt content in those as well, because they may be similar, may not be similar, and therefore we may not be having a beneficial effect. So lastly, what I kind of want to just kind of finish up here is with a few, I suppose, recommendations. So what can we do ourselves in order to keep our heart happy and healthy? And I know you've probably all seen this. I know in over the last few lectures, we kind of always kind of go back to this, which is our food-based dietary guidelines that we have here in Ireland, and the amount of foods that we should be having from each self. But things that I kind of want to pull out from that in terms of thinking about a healthy heart is that we should be choosing whole grain and fiber-rich cereal options. So we know that they have the beneficial effect in terms of cholesterol. We should have low-fat dairy, fruit and vegetables. We should limit the intakes of foods that are high in saturated fats. So you can see here from the top shelf here, we shouldn't be having these every day. They're high in fat, they're high in sugar, but also high in salt. We should choose PUFA and MUFA fat spreads and oils if possible. And we should eat 2 portions of fish a week, one of which should be oily. And then we need to moderate our salt and alcohol intake as well. And this is particularly in terms of a healthy heart. Now, I suppose I've focused on the dietary recommendations here in terms of good sources of protein, fats, and carbohydrates, and a rainbow of fruit and vegetables. But also other recommendations in terms of a healthy heart is that we need to be able to stay active. We need to have a healthy weight, potentially cut down on alcohol, try and get enough rest and sleep, quit smoking if possible, and also try and reduce stress in our life, because stress as well causes potentially can increase our blood pressure and cause negative effects as well. So they're the overall, I suppose, recommendations that we, if individuals can stick with, we potentially are giving our hearts, making sure our hearts are healthy. And also I'd like to point out, because I think they're a really good resource to have. This is from the Irish Heart Foundation. It's their shopping cards. And it's really to look at their labels and understand it. I kind of mentioned it previously in terms of plant-based foods. And, you know, we're saturated now in a market with loads of different plant-based foods, but not all of them may be healthy. And it's really important to look at the amount of fat and saturated fat and salt in our products as well. And finally, just to give a shout out to all the different resources that we have available if you want to look them up in terms of getting more information. So we have the Irish Heart Foundation, which has really lovely heart healthy recipes on their website as well, which is really good. We have Healthy Ireland in terms of the governmental website. We have Safe Food, we have Get Ireland Active, and also the Irish Dietetics Institute as well has information on heart health. So I'd like to thank everyone for listening and open the floor to any questions.